Our next slide is going to show us some of the muscles that are on the chest. The ones that are on the left are more superficial, and the ones on the right are deeper. We've already talked about the function of the sternocleidomastoid as well as the deltoid and the pectoralis major, as well as the biceps brachii. But and we've also discussed the coracobrachialis on the previous slide. You are not responsible for the subclavius muscle. And we talked also about the subscapularis. The pectoralis minor, which is going to be just deep to the pectoralis major, is going to be the chief medial rotator of the arm. And that occurs with the ribs that would be fixed. It also draws the scapula forward and downward. Whereas the next muscle that is listed is the serratus anterior. This is what is sometimes thought of as the boxing muscle, and it specifically rotates the scapula. I'll put it in a different color here so that you can see it. The next muscle that's listed here is the trapezius muscle. It's a very large muscle that's on the posterior side. It's going to be responsible for raising, retracting, and rotating the scapula. So we see a lot of muscles in this area that are all going to work on the scapula. We've already talked about the levator scapula, the supraspinatus, infraspinatus, teres minor, and teres major. We've talked about the deltoid. And the next group of muscles is the rhomboids. Remember, you don't have to know the difference between major and minor. Both of these muscles are going to stabilize the spine. And these muscles tend to be a little deeper. They're found on the right side of this diagram. The biceps brachii, just to remind you, is responsible for elbow flexion. The latissimus dorsi, which is a giant muscle, a lot of times it's referred to as the swimmer's muscle, and it's responsible for arm extension. It's an arm abductor. I'm sorry, excuse me, arm adductor, not abductor. It's an arm adductor because it's located more medially, and it's also going to be responsible for rotation of the arm at the shoulder. So on this slide, we see definitely the extrinsic shoulder muscles. They act in combination to fix the shoulder girdle, mostly at the scapula. They move it to increase the range of motion. And the actions include all kinds of things from elevation, depression, rotation, lateral and medial movements, protraction, as well as retraction. And as you can see, there's anterior and posterior groups of muscles. On our next slide, we're seeing a similar image, but we are also looking a little more closely at some of the other muscles like the trapezius muscle. So we've talked about the deltoid, the pectoralis major, the coracobrachialis. The triceps brachii is the antagonistic muscle for the biceps brachii, so it's responsible for elbow extension. So when you want to flex at your elbow, you're going to use your biceps, but the opposite muscle for that would be the triceps muscle. We've talked about the biceps brachii muscle, the brachialis, as well as the brachioradialis. Both of those muscles are going to be forearm flexors. We talked about the biceps brachii. You can see the origins and insertions shown here. Remember, the origin is attached to the immovable bone or less movable bone, whereas insertion is attached to the movable bone. On the right-hand side, you can see muscles we've already talked about, like the infraspinatus teres minor, major, triceps brachii, latissimus dorsi, and you're not responsible for the anconeus. Here we can see the subscapularis, which we've talked about, coracobrachialis, and brachialis as well. In our next slide, we're going to be looking at the forearm and the fingertips. There's a fair amount of these that you won't be responsible for, like the extensor pollicis longus, extensor pollicis brevis, the abductor pollicis longus. You should know the extensor digitorum, and that's pretty easy because it's going to be responsible for finger extension. The extensor carpi radialis brevis is also an extender, and it's going to extend the hand, and it has a similar function as the extensor carpi radialis longus. They extend, and they are going to abduct the hand and the wrist. And the reason for abduction is if you hold your hand in correct anatomical position, remember that the radius is always on the thumb side. If you abduct, you're going to pull your hand away from the body. So that's why it's responsible for abduction. You're not responsible for the extensor indices, the extensor digiti minima. As far as the extensor carpi ulnaris, it's also responsible for extension. And since it's on the opposite side of the radius, it's going to be responsible for adduction at the wrist. Whereas the flexor carpi ulnaris is going to be a flexor that adducts at the wrist as well. Remember, you're not responsible for the anconeus, and we've talked about the brachioradialis. As far as the image that's on the right here, there's several you're not responsible for. The extensor indices, across these off. You are responsible for the supinator, and just like the name sounds, it's going to supinate, and specifically, it supinates at the hand. So I always like to say that it forms a bowl of soup with the hand, where the radius and the ulna are going to be parallel to one another.